Today we'll talk a bit about hemorrhoids, and obviously hemorrhoids are a common complaint and a common problem within a proctologist office. Particularly, we want to talk about external hemorrhoids. External hemorrhoids can be acutely bothersome, where an individual develops severe pain and discomfort with a palpable nodule, or they can be chronically bothersome, where they have had such episodes multiple times over several months, or they have enlarged external hemorrhoids, which are causing other symptoms such as itching, burning, and issues with cleanliness and hygiene. Regardless, the initial important thing is to get a good history and perform an examination and rule out other pathologies that can mimic hemorrhoids. However, if the individual just has external hemorrhoids that are causing issues, in the acute setting when they're thrombosed and painful, as long as the symptoms have been going on for 2 or 3 days and not longer than that, we can treat them in the office and excise the hemorrhoid and provide relief to the individual within a few hours. On the other hand, if it's a chronically irritating hemorrhoidal tissue, then at the time the individual is usually not in severe pain and is looking for a more definitive kind of treatment. In that setting, if they don't have associated internal hemorrhoid issues, I would offer them excision within the office with local anesthesia to remove the external hemorrhoid. But because of the excision, the individual will probably have a few days of recovery where they will have some discomfort in that location as they would with surgery anywhere else on the body. As soon as internal hemorrhoids also get involved with external hemorrhoids, and internal hemorrhoids are the ones that are within the rectum, and the individual may or may not be aware that they have issues with internal hemorrhoids causing their symptoms. But if internal hemorrhoids and external hemorrhoids are causing the symptoms, then apart from medical management, if we were to treat this combination, we could either do multiple things, such as treat the internal hemorrhoids with a painless procedure such as rubber banding and excise the external hemorrhoid at a separate time, or more commonly we perform an outpatient procedure under anesthesia to remove the internal and external hemorrhoid cushion at one time. In that setting, if a single column of internal and external hemorrhoidal tissue is removed, it carries about a 1-week recovery, but provides significant symptomatic relief. If multiple columns of internal and external hemorrhoid tissue are removed, then that has a very significant post-operative recovery with basically 1 week of significant misery in most individuals and about a 3 to 4 week overall recovery. In that setting, the individual needs to be appropriately informed, and all of the decisions need to be made by the individual after getting appropriate information about different options they have, including continued medical management. And as long as the hemorrhoids are just a quality of life issue, the individual can make the appropriate decision for them. Now, there are some settings where I strongly advocate having this extensive procedure called an excisional hemorrhoidectomy performed in the operating room. And those are times when individuals have severe internal hemorrhoids and severe external hemorrhoids to the point that I've had individuals that have had the need to require blood transfusions because of the chronic blood loss from the internal hemorrhoids. In that kind of setting, I do advocate for a definitive kind of procedure. However, for the most part, treatment is tailored to individuals with them having multiple options from which to choose. And the job of a proctologist is to appropriately inform the individual about their disease process and the options that they have.